A very good afternoon to all the dignitaries. We are thankful to ILBS for giving us the opportunity to coordinate this webinar. We are thankful to our Director, Dr. Rakesh Kakkar sir, and Director ILBS, Chef Sareen sir, and also to the Dr. Aarti here, and especially to Umesh Kapil sir, who has facilitated this webinar. So with this being included in the national program, and lot of awareness is generated due to inclusion of this NFLD in national program, and to continue it further. Though most of the presentation is already covered by Sareen sir and other dignitaries, so I'll just take a brief review because all risk factors are almost discussed. So primary and secondary prevention plays a very important role. If we can limit these risk factors, especially lifestyle factors, we can limit, but in genetic factors, there is some limitation which we cannot limit much. So my talk will be highlighting on these three aspects, that is pathological factor, genetic factor, and lifestyle factors. So first, coming to the pathological factors. So here, as you can see, that metabolic stress or metabolic syndrome, there is a strong correlation between both. So NFLD development and progression involves a complex interplay between the metabolic, genetic, and other disease-modifying factors that potentially act in concert. So further highlighting the heterogeneity of disease spectrum. So NFLD is a part of systemic disease with a strong association with components of metabolic syndrome. Multifactorial metabolic stress has direct effect on multiple tissues and cell types.
We are sorry for there was a connection disturbance. Sir is just joining in a second. Sorry for inconvenience.
So, are very important, especially if we'll discuss about the waist circumference. The waist circumference in males is, if it is more than 90, or in female, if it is more than 80, then it significantly increases the chances of NFLD. Similarly, triglyceride level of and HDL level of less than 40 is in males is required. If it is less than 40, then it is again a risk factor. And similarly in females, if it is less than 50, then again it increases the chances of NFLD. Similarly, if hypertension of more than 130 systolic or 85 diastolic is there, then also it increases the chances of development of liver or fatty liver disease. So obesity itself is an independent risk factor. Person can also develop NFLD, which was well explained by the Sareen sir in earlier presentation. So, but obesity increases the chances of development of NFLD, and it is an independent risk factor for non-alcoholic fatty liver disease, which is evident from these 21 cohort studies in a meta-analysis. Similarly, diabetes is also an important risk factor, and one lead to, if NFLD is there, then we can explore the possibility of diabetes, and similarly if diabetes is there, then we can see whether NFLD is present. So both increases the chances of one another. Now, similarly, if there is a hypertension or dyslipidemia, so, these also increases the chances of non-alcoholic fatty liver disease. And if the fat composition or fat is quite enough, and other lifestyle factors also. So all these factors work in jointly and lead to development of atherosclerosis and hypertension, chronic kidney disease. So these factors. So if disease has progressed to NASH, so you can see there's a higher chances of insulin resistance, and which is around 98%, which was observed in one of the study. So these are one, that is one lead to another, or there is a strong correlation between all these things. So metabolic syndrome is also possible in high percentage of, or there's a high prevalence of metabolic syndrome if a person has developed NASH. And diabetes mellitus is present in 70% of the cases. So if NFLD or NASH is present, so one can look for other like diabetes or metabolic syndrome or cardiovascular diseases. So similarly, gut dysbiosis is also very important due to disturbance in the gut flora or changes in the the liver gets most of its blood from the intestinal vascularization. So it is constantly exposed to the nutrients, toxins, antigens from food to the product of the gut microbiota. So the microbiota itself, meanwhile, the gastrointestinal tract is a liver product from the bile acid, which is channeled through the biliary duct. Thus, functional bidirectional relation between the liver and the gastrointestinal tract is known as gut-liver axis. So this increases the chances, gut-liver axis increases the chances of development of NFLD. So because of this close anatomical and functional relationship, changes in one component such as gut barrier or a gut microbiota can affect the condition of liver. The relationship between the gut microbiota and the liver disease has long been known. Sleep apnea is another independent risk factor which has been noticed in various studies. So obstructive sleep apnea is associated with the development and evolution of non-alcoholic liver fatty disease, which is an independent risk factor of obesity and other or other shared risk factors. Now, hormonal imbalances play a very important role, like hypothyroidism, hypopituitarism, or hypogonadism, and polycystic ovarian disease. All play a very important role in the development of NFLD. Other important diseases include pancreatobiliary, not disease, these are the condition like pancreatobiliary diversions, total parenteral nutrition, high fructose diet, and Wilson's disease, hepatitis, inheritance, also important in development of this. So these are the various risk factors which lead to or which help in progression of the disease. Now coming to the other important aspect, which is genetic plays a very important role, and genetic and epigenetic play a key role in the development of several diseases, including NFLD. The new genetic determinants of NFLD will continue to appear in the coming years. To date, there is no approved pharmacologic therapy for NFLD, and current treatment remains lifestyle modification with dieting and exercises aiming at weight loss. Therapeutic approaches involve potential modulation of the activity of enzymes responsible for DNA and protein epigenetic modifications. On the other hand, gene expression regulation is also provided by non-coding RNA. The evaluation of circulating miRNA profiles represent a promising approach to assess and non-invasive monitor liver disease severity. although this tissue still requires independent validation. So these genetic factors or genes affect the progression of, or these are the independent risk factors, and these increases the chances of various other diseases or metabolic syndromes. And we can do very little about these genetic factors. We can largely concentrate more on reducing the lifestyle factors. That is, more favorable lifestyle will help in decreasing the burden of these liver diseases. So some other genetic factors which at each level different genetic factors or genes act and like genetic modifiers of insulin sensitivity or resistance, different genes are involved. Then at steatosis, genetic modifiers of fatty acid flux and triglyceride level. So you can see the at different level, different genes are acting and regulating the progression of disease. Coming to the lifestyle factors, so if a person is consuming too much of junk food, which ultimately will increase the chances of obesity, hypertension, and other non-communicable disease. So on this overall environmental factors, sedentary lifestyle, imbalanced diet consumption, substance use, abnormal sleep pattern, and sedentary lifestyle and mental well-being, all these factors, or these big 6 lifestyle factors, play a very crucial role, and largely these factors can be controlled by the person, and which can ultimately help in managing or reducing or controlling these factors. And nowadays, due to the lot of publicity of these like Swiggy, Zomato, and McDonald's, and lot of other things are coming, and they use very catchy type of advertisements, and especially during the COVID time, when most of the people are in their houses and only few are concentrating more on the exercises, so lifestyle is disturbed. So we should still focus more on limiting these factors and increasing our exercise hours, so that these factors can be limited. All these factors, these are vital and are required for everyone, but balance is always required. That is how much we are dependent on these gadgets or labor-saving devices. If we'll do enough of the exercises by either cycling, running, or with some sports activity, so physical build or this physical environment is very important. This slide, part of it is already discussed. So this lifestyle plays a very important role, and in addition to the heredity, so environment, hereditary factors, genetic factors, and different geographical location, all put together, they increase the chances of these liver diseases. So again, in this slide also, you can see that NAFLD is largely driven by unhealthy lifestyle, aging and genetics. So NAFLD is present even, can be noticed even in children, but with increasing age, in both male and female, but with it is noticed more in females. Now we can see that the confluence of risk factor for cardiovascular disease and NAFLD. So some are the independent risk factors, like family history increases the chances of CVD, ethnicity, age, tobacco exposure, physical inactivity, alcoholism, unhealthy diet. All these are the independent risk factor for CVD or NCD as well as for NAFLD. But the common thing which increases the chances is metabolic syndrome, hypercholesterolemia, obesity, and diabetes mellitus type 2. So once a person develops a fatty liver, and further progression depends on these factors, and these factors can be categorized into three factors, that is low risk profile, intermediate risk profile, and high risk profile. So if BMI is comparatively less, then or age is less than 40, there is no diabetes mellitus, then we can place it in the low risk category. While if the BMI is higher, or the age is higher, or the AST level is more than this already Sareen sir has discussed in his presentation. So I'll not go into the details, but these depending on these markers or different values, we can categorize, and we can control, and we can hold the progression, and this categorization will also help in managing the patient. So in summary, all these factors play a very important role, like metabolic syndromes, lifestyle factors, hormonal disturbances, and other genetic factors. Lot of medications also increases the chances of steatosis, and ultimately can lead to non-alcoholic steatosis, hepatitis, and which may later progress to cirrhosis or cancer also. So some of the factors are under our control, and some are beyond our control, like genetic factors. So thank you.